Good afternoon and welcome to the City Club of Cleveland. My name is Joe Simperman, representing Ward 3 on Cleveland City Council, and at this time I'd like to thank the City Club, St. Luke's Foundation, and the Cuyahoga County Place Matters team for being the bearers of the light of our next speaker. I'm very pleased to introduce today's program, Why Place Matters. As the first in a series of the same topic, Dr. Christopher will paint a picture of how an individual living in Lyndhurst, Ohio, a suburb not 15 minutes east of Cleveland, has a life expectancy 24 years longer than an individual living less than 10 miles away from this address in the Huff neighborhood of Cleveland. Dr. Christopher is the Vice President for Health Programs at the W.K. Kellogg Foundation, and her work with the Joint Center for Political and Economic Studies has brought to national attention our country's historical and present reality that racial segregation leads to the segregation of resources, which translates to a lack of access to quality schools, health care, and nutritious food for people of color in all of our communities. It will come as no surprise to anyone in this audience that this is a reality here in the city of Cleveland and the surrounding area. Why even on this street, not 30 years ago, determining who was a member of a club or not was based on your race. Dr. Christopher has more than 20 years of experience of fighting for human rights. She is the author of 3 books and is the former executive director of Harvard University's Institute for Government Innovation at the John F. Kennedy School of Government. And in 2004, Dr. Christopher put on the national consciousness the Place Matters initiative. Place Matters is a national project made up of leadership teams from counties where people of color live in high concentrations and experience health disparities. Under her leadership, Place Matters team across the country, here in Cleveland, Ohio, and Cuyahoga County as well, are creating data-driven strategies on reducing health disparities. Dr. Christopher has embarked on an effort not just to save the lives of the American people, but also to save our souls as well. The City Club has partnered with St. Luke's Foundation of Cleveland and the Cuyahoga County Place Matters team to present this series discussing various health disparities and the social determinants of health. From this podium have spoken presidents, CEOs, and leaders of our country. If the Gospels were being written today, Dr. Christopher would be one of the evangelists. Ladies and gentlemen, Cleveland's own Dr. Gail Christopher.
Thank you so much, Councilman. It is indeed an honor and a privilege for me to have been invited here today. It is a homecoming of sorts. As some of you know, I actually grew up in Cleveland, and my first apartment as a married woman was in Huff. So I know this city very well. I bring you greetings on behalf of myself, the Board of Directors, and the President of the W.K. Kellogg Foundation as well. When Mr. Kellogg left his fortune to the foundation, he simply said, "Do what you will with the money, so long as it helps children." And as you celebrate the almost 100th anniversary of the City Club, and you launch a campaign for a new century, we are indeed a partner with you because our work on behalf of our nation's vulnerable children is in some ways, although we don't call it that, a campaign for a new century, because we envision a nation that marshals its resources to assure that all children thrive. All children thrive. And so we naturally focus on the children who are not thriving. And as the demographics of this country shift, even today, most of the children in our nation being born today are children of color. Most of the young children in our nation today are children of color. And most of those children live in low-income or impoverished circumstances. Now, take that in for a moment. What does that say about the future of our country? It says that we have some work to do, and we need to begin that work now in a way that is unprecedented. And so I know I'm in good company when I bring you a perhaps provocative and maybe even controversial suggestion. We at the Kellogg Foundation have launched a national initiative that we call America Healing. And the purpose of that work is to give our country tools and resources and to build capacity within communities to address the unfinished business of the absurd mythology of racial hierarchy. You see, our nation was built and founded on many wonderful belief systems. But among those was a not so wonderful belief system. And that was the belief in racial difference and racial hierarchy. Now, some people say that's the past, and now that we have our first African American president and first family, we are in a post-racialized America. But we have metropolitan and urban residential segregation levels in this nation that are comparable to South Africa at the peak of apartheid. And so we really do have unfinished business. Now, people don't like to talk about this unfinished business, and they certainly don't like to acknowledge its impact. But we know, and we are proud as a foundation to have funded. We actually couldn't fund all of the requests. We received over 1,000 requests from communities around this country. But we were able to fund over 100 communities that are willing to roll up their sleeves and deal with the consequences of a belief system that is enshrined in our Constitution and in every system in this nation. Now, what does that mean? That means that on a conscious and unconscious level, and unconscious is where it really does its work, we believe in this hierarchy. Now, we talk about place matters, and a speaker reminded me recently, I always think of place in a geographic sense, especially when we focus on residential segregation. But a speaker reminded me that there is a place on that racial hierarchy. And if you're at the top of that hierarchy, you don't even have to think about it. But if you happen to have physical characteristics that put you at the bottom of that hierarchy, you live with this reality every day of your lives. Now, I want to share a quick story with you. I like to think that I'm post-racial. Just kidding. I like to think that I've done a lot of work over the last 30 plus years becoming less imbued with this belief system. And so recently I undertook a project to have my home remodeled. And it was primarily my kitchen. I watched much too much HGTV. And so they were there. And so the big question today when you're remodeling an old house is taking a wall down, right? And the big question is that wall load-bearing or not? So I had 5 contractors tell me it was not load-bearing. I had 3 contractors tell me it was load-bearing. So person that I am, I decided I would find out. So I did the research. I got a flashlight. I found out what a joist was. I went down the basement. I decided this wall was not load-bearing. And I hired a contractor who agreed with me. So there we are in the middle of demolition, right? And as they've done almost all the demolition, they're about to go to the wall, the foreman comes in and he says, "What are you going to do if it's load-bearing?" to the worker. The worker assures him that it isn't, but of course I get nervous, right? So I have to leave, though, to catch a plane shortly. So I go upstairs and I start packing. And at the precise moment that they start to take down this wall, my house starts rumbling. I mean, literally, I tell people my house was doing the Watusi. I mean, it was just, I know, I tell you how old I am. But, so I run downstairs and I say, "What have you done to my house?" And the worker who's from Guatemala, they've all run outside, right, the family. And I said, what have you done? And they look at me and they say, no, ma'am, it was an earthquake. Now, this was in Washington, D.C. And so, of course, I put my hands on my hips and I proceeded to say, what kind of idiot do you think I am? And every negative stereotype I had in my subconscious about these immigrant contractors came to bear, right? They were not fair. They were taking advantage of me. They didn't know what they were doing. He says, no, ma'am, it was an earthquake. He says, turn on your television. You'll see. So I go in and I turn on my television, and guess what it says? 5.9 earthquake hits Washington, D.C. So I was reminded and humbled and asked him to forgive me and prayed that he would continue to work on my house in good faith and do a very good job, which he did. And I share that story with you just as an illustration of how these beliefs and attitudes are so embedded in our own consciousness. And they affect the way teachers relate to students. They affect the way doctors relate to patients. They affect the way we relate to one another, even within our own races and communities. And so this idea of finding the roots of this mythological construct of racial hierarchy, finding those roots and lifting them up. Some people ask me, what will success look like? One day, when my children, my grandchildren or great-grandchildren, will open a textbook, and the textbook acknowledges the mythology upon which this nation was built, and the textbook honors the contributions of all groups to our society. When we admit as a nation that we had it so wrong and we are living with the legacy, we talk about health disparities, we talk about health inequities, we talk about achievement gaps as if they are a surprise. How could you deny the humanity of a people for 3 centuries, struggle against a cantankerous, resistant Congress? We know a little bit about that today. To pass a civil rights bill which you had to water down and diminish in all its enforcement properties, and think that you had undone 3 centuries. But that's where we are today. We are collectively in denial. And it's time for us to move beyond that, not just because of our hearts, and it's the right thing to do, but we have to do it for the future of our country. I remind you that most of the children are and will be children of color. Will we continue to cripple them? To force them to grow up in communities that are residentially, racially segregated? When we see the outcomes of a 24-year disparity in life, we have to go to the roots. We have to go upstream. That's what the social determinants of health movement is about. It's about looking beyond healthcare, although healthcare is part of it. And this is a global movement which has its real impetus outside of the United States. But we must embrace it here in this country. We must recognize that a quality life is the best predictor of a healthy life. Now, an article appeared in the New England Journal of Medicine just yesterday. This is groundbreaking science, where they looked at obesity and diabetes rates. And you know, those are the epidemics that are breaking our country right now. They looked at a dramatic decline in obesity and diabetes rates among women who were allowed to move out of concentrated poverty. This is the Moving to Opportunity program, which looked at the federal government's Section 8 housing voucher program. There was an experiment within that program where some of the women were allowed to move into higher income communities. And what did they find? They found that their health improved. Now, to me, as a physician who's worked with thousands of patients, for me, that's a no-brainer. But for our understanding of health and well-being in our society right now, that comes as a breakthrough insight. Yesterday there was an article in the New York Times that was entitled, "Occupy the Classroom." How many of you read it? It reminded us that educational success is determined by readiness for school and education success before the third grade. It reminded us that we as a nation need to assure access to universal preschool if we're going to see a better future for children. The achievement gap needs to be addressed before they enter school. Now, we at the Kellogg Foundation have embraced a framework that embodies the social determinants, and that includes a real focus on education, particularly 0 to 8, a real focus on access to quality food and those conditions that promote health and well-being, and then finally, family economic security. If you want to predict longevity, look at education levels and income levels. So I invite you in Cleveland to take that broader view and really make a decision. I remember when I left Cleveland, Cleveland was not in the best shape economically. In fact, they were calling it the mistake on the lake. How many of you lived through that era of Cleveland's history? And of course, the lake was turned around and the economic viability was improved, and Cleveland is a destination now, particularly with the Rock and Roll Hall of Fame here. But I would invite you to make Cleveland a destination because you have had the insight, the courage, the determination, and the will to address the inequities that are a legacy of the unique racial history of this city. This city, like every town, like every county, like every zip code, has a unique racial history. Our ability to ignore those histories, to deny them, is a tool of continued oppression. The absence of history is the greatest tool of oppression. And so I ask you to do the interviews and talk to the elders and the seniors and spend time in that marvelous public library we have here in Cleveland. I used to spend most of my Saturdays there. And dig up the unique racial history of Cleveland. Talk about it, confront it, overcome it, reconcile the differences, and build a city that embraces all of its children and all of its people. Now, is this work easy? No. But I can talk about the requirements for this work. You have to bring diverse people to the table. Like this room, for instance. And then you have to share the stories, not unlike the story I just shared with you. Or some of those unpleasant stories. My son, who is now 36, when I went to the hospital to give birth to him, after I had lost my firstborn, which so many African American women do, I was very careful. I picked the best doctor in town, and actually I was going to have a home birth. But my doctor was away delivering triplets, and she couldn't see me, so I was rushed to the hospital. I got to the hospital. The doctor was on his way. And when he arrived, he said, "Why is she over there in that corner? Why isn't she being prepped?" And the young resident responded, "Well, she's black." So I figured she was on welfare. Fortunately, the doctor read him the Riot Act and insisted that I be treated equally immediately. And my son, who was a breech presentation, so you know the risk there of waiting to care for me, he was delivered without any problems, and he's a healthy child today. But that's a real story that reflects the legacy of which I speak. And that young doctor who made that call felt perfectly justified in making that call. Because, you see, he lived at the top of the racial hierarchy. And he didn't think I had value, nor did my child have value, because we were, in his mind, at the bottom of that hierarchy. But most importantly, it was unconscious on his part, because he was justifying it by what he'd been taught about reimbursement rates for Medicaid. So this is the complexity of the web that we have to work ourselves through. That expression, oh, what a tangled web we weave. We have deceived ourselves. And in that deception rests the genesis of what we call health disparities. The last thing I would say to you about that, because there is a movement now, nationally, globally, to think about transportation and education and the quality of the air we breathe, and most importantly, access to quality food. And then the medical, clinical folks feel a little left out of that discussion because they haven't been trained to deal with these social factors. So how do you bring these two worlds together effectively? I suggest to you that the coming together is around the physiological and biological impact of exposure to chronic stress, chronic deprivation, and chronic discrimination. Because that impact is indeed biological and physiological. So you have elevated blood pressure. You have depressed immune responses. You have accentuated and accelerated inflammatory responses, all of which come together in a cascade of chronic disease. I was humbled recently to be part of the United Nations delegation to their High Council General Assembly special session on the epidemic of chronic disease that burdens this entire world. Our future as a planet depends on us grappling with these issues in a more holistic way. It was the Caribbean nations that drove this focus at the United Nations. And as I sat there and listened to the leaders of those countries, in my mind, I was tracking the Atlantic slave trade as it progressed through those countries. This unfinished business is killing us. And if it is killing some of us physically, it is killing the rest of us economically, psychologically, emotionally. And even though our president dare not speak of the issue, I would invite you, as a noble and powerful city, to embrace this challenge, to embrace the challenge of moving as far upstream as you can in addressing health inequities. But I'm also reminded that we can't give what we don't have. And what we are being asked to give to one another is quite simply love and understanding. But that will come from a transformation of our own hearts, a deeper appreciation of our own selves, a deeper appreciation of the miracle of the lives that we have been given, and an extension of that love to others. So I thank you. I am humbled and honored to have been able to come home to Cleveland in this special way. Thank you very much.
Thank you so much, Dr. Christopher. Today at the City Club of Cleveland, we are listening to a Friday forum featuring Dr. Gail Christopher, Vice President of Program Strategy at the W.K. Kellogg Foundation. We will return momentarily for our traditional City Club questions. We encourage each and every one of you to formulate questions for our speakers now and remind you that your questions should be brief and to the point. We welcome all of you here and those listening to WCPN 90.3 FM, WCLV, WTAM, or one of the many radio stations across this nation. Our television broadcast partner is WVIZ PBS IdeaStream. Television broadcasts of the City Club are made possible by Cleveland State University and PNC, and our live webcast is supported by the University of Akron. We are especially pleased to welcome guests at tables hosted by Kent State University, Lutheran Metropolitan Ministry, Metro Health, Neighborhood Progress, Inc., the Cuyahoga County Place Matters team, and of course, St. Luke's Foundation of Cleveland. Thank you for your support. We are also especially pleased to welcome students who are here as part of the City Club student program. Participation of these students is made possible by a generous grant from Jeffrey David Epstein Memorial Student Fund. With us today are awesome students from Cuyahoga Valley Christian Academy and Shaw High School. Will you great students please stand and be recognized? Now we would like to return to our speaker for our traditional City Club question and answer period. We welcome questions from everyone, including guests, especially our students. And holding the microphone today is City Club Program Director Carrie Miller and Special Initiatives Coordinator Phil Williams. Now for our first question, please.
Dr. Christopher, during the past year, there's been a significant drop in the funds that are available for the various programs that you discussed today. Drop in federal funds, drop in state funds. My question is, to what extent do you feel that the philanthropies, of which you represent a major one, the Kellogg Foundation, is able to pick up that slack in the funds? And if you cannot, is there any suggestion as to where that remainder of funds can come from so that the programs you described today can be continued?
Thank you for that question. It really does hit at the heart of the challenge we face as a nation. If you combined all of the philanthropic dollars in this country, it would be just a drop in the bucket of what it costs to create a social infrastructure for a viable democracy. And so the debate that we have right now, the concentration on the deficit, I believe is a bit misguided. The focus needs to be on what must our country do to benefit our children and our future. Once we determine what must be done, as we have in the past, then we must determine how to pay for that. To get into these divisive arguments that have drawn lines in the sand as to what is and is not on the table, I believe is childish at best and destructive at worst. We have to have a country that understands what it costs to build a viable social infrastructure and develop a healthy people. And so I would ask everyone to become an engaged citizen and help to drive this conversation back to a rational platform that considers the future of our country.
Good afternoon. As a resident, 25-year resident of the Huff community, I'd be very interested in the specifics of the research that determined there's a 24-year difference between Lyndhurst and Huff. Can you speak to that, please?
This work has been occurring throughout the nation, and Huff is just one of the examples. In it, they look at death certificates and causes of death and life expectancy. The research is grounded in the public health field as well as epidemiology. And the Joint Center for Political and Economic Studies Health Policy Institute, with funding from the National Institutes of Health, has a series of reports that reflect these disparities in life outcomes and life trajectories, not only for Huff, but for places in Atlanta and Memphis and other areas. So I would direct you to their website to look at the more in-depth reports. New Orleans perhaps is the most astounding set of disparities or inequities. I think there's an over 30-year life expectancy difference in some of the communities. And this is right here in the United States. This isn't in, quote, the developing world.
Dr. Christopher, the issue of health disparities is a problem that is broad, it's deep, it's complex. Are there any cities that have developed strategic plans to legitimately address the disparities, looking at really best practices and legitimate strategies?
I would say, first of all, that the field has evolved over the last maybe 40 years in terms of health disparities to really framing them as health inequities. Because the disparity frame allows it to be a more research and numbers conversation. When we frame them as inequities, we open the door to considering the broader context through which many of these issues have to be viewed. I'm most impressed with the work in King County, Seattle, Washington. They've developed an actual ordinance within their city to look at inequity issues and to take actions to hold their public health workers and their other workers accountable for addressing inequities on a consistent basis, in distributing resources, in making decisions about the city plan. So I think I hold King County up as one model. Another amazing story comes from Boston, Massachusetts, where the public health commissioner there has decided that infant mortality inequities, disparities, will no longer be tolerated, and that every person in the public health department, from the emergency driver to the anybody that's involved in public health, will determine what they can do to reduce infant mortality. Everyone has a role to play. And as a part of that effort, every employee in the public health department is going through a staff development experience that opens their eyes and hopefully their hearts to the dynamics of the legacy of a racialized Boston and gives them tools for being more effective in their day-to-day interactions and in creating relationships, in making decisions that can be life or death decisions based on what they feel and see at the moment. I think Seattle and Boston hold a great deal of promise. There's a story that comes from Los Angeles that I absolutely love, where we've all heard of neighborhood watch programs, and this is a neighborhood food watch program, where the neighborhood residents, led largely by youth, actually went to the retail outlets for food in the community, and they assessed the quality of that food. And in many cases, the food that was on the shelves was way past its expiration date. In some cases where there was a large grocery store chain, and there are far too few of them in urban areas, they were able to note that people doing the same jobs were actually being paid different salaries based on racial differences. And so they developed a way of assessing what was really going on in their community and holding these retail providers accountable for a higher standard of performance, figuring out ways to incentivize better refrigeration so that more healthy foods could be available on the shelves, more culturally appropriate foods could be made available. There is a health benefit to empowerment. When you feel that you can have a role to play in solving what seems like an intractable problem, your blood pressure decreases. There's something about a sense of power and control that is part of creating a healthy society. So the food, there are many cities around the country that have developed food policy councils. And those councils are setting standards. Another methodology that is critical, and I think it should be a big part of what Cleveland does in its Why Place Matters work, is the health impact assessment. Being able to determine, if you do this, what impact will it have on the health of the community? And the state-of-the-art of health impact assessment is pretty developed at this point. And it's useful in city planning, in neighborhood planning, in negotiating with developers. There are some, particularly in Atlanta, where people, when there are major developments about to take place, major transportation decisions about to be made, where the residents have been involved in health impact assessments, and they've been able to negotiate concessions that are in the best interest of the community. And so there is a real technology that is evolving to address these issues in a holistic way from a social determinants frame. And I'm really pleased that some folks right here in Cleveland have been part of the community that's emerging, the community of practice in this country, which is called Place Matters, that is bringing together this insight and this knowledge, and hopefully will accelerate us moving to a truly healthy America.
Hi, my name is Jasmine Vaughn. I'm a Shaw High School college-bound senior, and my question was also focused on the life expectancy of different cities. And I was wondering if you can please tell me the website that you have found that information on, because I was specifically wondering about East Cleveland compared to any other rural cities, and I was wondering if you had any suggestions on about how I could let my community know about our life expectancy.
Well, I would, the particular body of work that the National Institutes of Health has funded is being done by the Joint Center Health Policy Institute, and I believe that's, you can Google Joint Center Health Policy Institute, and it will come up. But the CDC, the Center for Disease Control, is really the center of this longevity research. And so I would direct you there. I don't think that every county and every zip code has had that sort of assessment and research done, although it's getting there. Counties are usually the beginning, and then when they get special funding, they can go down to the zip code and neighborhood level and come up with the kinds of data we have on places like Huff. But it is an evolving science, and I would direct you first to the Center for Disease Control and to the Joint Center. Other questions?
I first want to thank you for a very wonderful presentation. I'm Tony Miner. I'm a pastor, and I'm also the Director of Advocacy for an agency that's funded by the St. Luke's Foundation. And we have a project where we're working with churches, and I'm here with some colleagues, some pastoral colleagues who are very much engaged in this work. I want to hear from you about the role of the faith community and how important it is for us to, how important it is for that community to be part of this work.
The faith community remains the strongest institution in most minority communities. So the role for the faith community cannot, I believe, be overestimated. How you translate that position of power and influence into effective work on behalf of the community is another discussion, which requires some real thought and some real creativity. And some, I believe, some learning also. I know that the meals, for instance, that are served in the church are not always the healthiest meals. But I think the term is the gospel bird. And so one place to start is in transforming the community or the congregation's relationship, if you will, to food, and doing so by modeling. Another place to work is in developing this deeper understanding on the part of the faith community, the congregation, of this frame, this larger frame of social determinants. I'll tell you a story from Minnesota, and it's the faith community, and it's a faith advocacy ministry that's leading this work. They were about to make a new transportation decision where they were putting in a new rail line, and that line, like many places around the country, was going to bypass the low-income community, right? It was going to bring people from the suburbs into the shopping area, and it was going to take them safely back, bypassing the low-income community. It was also going to deny people opportunities to transportation to access jobs, because particularly as oil prices go up, people need public transportation to go to where the jobs are. But this community came together, led by the local church, and stood up and insisted that those plans be rewritten and that rail line be rerouted to honor the humanity, to honor what all these communities deserved in terms of access to transportation. Now, that same strategy is being talked about in Detroit, because Detroit is about to undergo a similar transformation, to move more people through Detroit. But they will definitely move people past those parts of Detroit that we don't want to talk about. But that's not acceptable. That is a health impact assessment at work. That is a city planning for equity process at work. So the faith community, because it has the people, has people who want leadership and who are willing to stand up, can play very significant roles. The faith community can play significant roles in the provision of after-school programs. I tell people all the time, the first book I wrote was called Anchors for the Innocent, and it was about single parenting, because I am a divorced single parent, and I've raised 2 healthy children. And I tried to communicate to single parents in that book, when you have children, you have made a decision that your first responsibility is to provide the attention and the care that that child needs 24/7. The school cannot do it. Relatives can't do it. As a parent, you have made a commitment to provide the attention and the focus that those children need. In our society, when people have to work 2 and 3 jobs, that means they have to have access to viable after-school programs. They have to have access to viable before-school programs. They have to have safe places to recreate on the weekends. They have to be protected during the summer months if we aren't lucky enough to have year-round schooling. And so the church can play a very critical role in providing those supports and resources that are necessary for families to work. They can also play a critical role in the literacy challenge that communities face. I could go on and on forever, but if you just did those things, you play a major role, potentially, in changing health outcomes and addressing health inequities. But thank you for the question.
Louise Hudson from Office of Health and Human Services, Family and Children First Consul, and I'll make it quick because I can talk forever too. But just attended a workshop that was conducted by the Centers for Community Solutions on youth and the immigration of immigrants and refugees. And I know that they have good agricultural skills and good farming skills. But what's taking place here in Cleveland, Ohio, there are farmers markets, vegetables. They're just doing everything to help us to visit these markets that are selling these vegetables, fruits, and everything. That being said, and let's say we have a clean slate here in Cleveland, Ohio, what can we do to help our youth and young children to grow up to have healthier lives?
There is another emerging movement in this country right now, and I think actually Detroit is the center of it, because Detroit has lost so much housing. There's so much vacant land in Detroit. I don't know if that's true in Cleveland or not, but I thought it might be. But many of those vacant lots are being turned into community gardens. And I know that might seem a little bit like a foreign concept, but how many of you have tasted a tomato from your own garden? All right, it's a little bit better than the tomato that's been on a truck and in a hothouse and et cetera, et cetera. So community gardening is a strong movement, and there are non-profit organizations that are driving that movement. If kids have the experience of growing fruits, I'll never forget, I was working in the public housing community in Chicago, and I was astounded. Many of these children, they didn't know what some vegetables were. They didn't know they had never seen these fresh vegetables, you know. They thought that macaroni and cheese came in a box. You know, they didn't know that it could be made a different way. And so we have come a long way from exposing our children to quality food. There is also a major movement to improve the quality of school food. I don't know how active Cleveland is in that movement, but bringing in locally grown foods into the school lunch program it has a transformative potential for children through what they eat in school, what they learn about food. Also, there's also a deeper and deepening understanding of the role of nature in enhancing child development. And Richard Louve's book, Last Child in the Woods, he has a new book out. This children and nature movement is gaining momentum. It appears that the Creator, in divine wisdom, had something going on there, you know, and that the more exposure we have to nature, the healthier we are. It has a direct effect on the nervous system. Children with attention deficit disorder are improving in terms of their learning capacity the more time they simply spend outside in nature, around greenery and trees. So there's a lot we can do to make our children healthier. It has to be safe for them to be outside in nature, and we have to protect natural spaces in our environment. Not only do children benefit, adults benefit as well. There are studies that show people recover faster when they just see nature, when they're looking out of a hospital window. There's also another movement that's quite exciting called Healthcare Without Harm. I know there are a lot of hospital executives here today, and this is a movement to improve the quality of food in the hospitals. Hello. I remember my third day in a hospital after surgery, and they said, "Can we help you? Can we do anything?" And I said, "Could you just bring me a banana? You know, just something fresh?" And the woman looked at me and she said, "We don't have any fresh fruit in the hospital." And this was in New York. And I said, "Well, could you all sign me out? You know, can I go home and get some healthy food?" But this movement, Healthcare Without Harm, is taking the same concepts of bringing locally grown food into the schools, transforming the quality of food in healthcare facilities. And that is exciting. And, you know, most of this work that I've described to you is work that the Kellogg Foundation is funding. Someone asked, the first question had to do with what philanthropy can do. In most cases, we can support the innovation. We can support the pilot almost. I'm happy to say that this administration has really picked up on the issue of quality food, and there are actual now federal dollars to support what we call fresh food financing in communities. So you're going to see a return to hopefully a better quality of foods within communities. And that federal money can help to catalyze more private investment in producing healthier foods within communities. So, you know, we're moving into a new century, and there's a lot of work to be done. But the good news is there are a lot of answers if we really buckle down and determine that we won't stand for the status quo, and we won't be led by... Yes, I was about to say what I truly feel about some of the conversations that are happening right now at a national level. But I'll be gracious and say that we won't allow ourselves to be led by people who might be in a state of arrested development. You know, it takes an adult to hold elected office. And so we want to think about that when we go to the polls, you know. We really have to have been able to show some, to have demonstrated, to have shown some evidence of adulthood and maturity. Because these are tough calls that have to be made. And they're calls, I should say that the Native American community has this concept, many of the nations do, of what I do today affects 7 generations, you know. And yet we seem to have an amnesia about that. We seem to think that what I do today is gone tomorrow, you know. Now, today's era of internet and technology, you know, it's conducive to that kind of thinking. But on a spiritual level, what we do today does affect 7 generations. In fact, there was an article in the paper yesterday that talked about what they call epigenetic impact. They're finding that the health and life expectancy is shaped more by the other factors other than the genes that a parent passes on to future generations, not just their genetic coding, but their life experience. These are epigenetic factors. So here we see in the actual body itself the manifestation of the multi-generational view. But it's clearly evident on a social level. We are living with today the legacy of many generations past. Let us convince ourselves and commit ourselves to leaving a better legacy for the generations of the future.
Dr. Christopher, I applaud your work on health care as a correlate for success in life because people can talk about it. But I'm someone who has for a long time been moved by the power of family structure to affect outcome. And I'm reminded that about 20 years ago from this same podium, a man named Leon Dash from the Washington Post talked about his research with teenage mothers and how startling it was to him to discover that the mothers of, these were really children having children, this wasn't an accident. They really wanted the children. It was a source of meaning and something that didn't happen by accident. It wasn't a lack of knowledge about birth control. And this has, for years, stayed with me as an indication of how tender and difficult the whole topic is of childbearing, pregnancy, family structure, and how hard it is to get the conversation going. But in terms of consequence, not just for African Americans, but for really all parts of the social, of the ethnic spectrum, the lack of two-parent families has become, I think, a tremendous burden. And you sound like you've dealt with it yourself. Single parenting is tough. Can you talk about whether or not your foundation is seeking to get the conversation going on this tremendously tender topic of when do we have children, when do we begin starting to form a family, how do we get people to wait until they are best able to raise children?
I appreciate the question. And when I wrote the book Anchors for the Innocent, I was very deliberate in putting two parents on the cover. Because contrary to nomenclature, there are always two parents. Children are not conceived in isolation. And we have tended to frame the single parent phenomenon as a mother-child phenomenon. It is not. It is a father-mother-child phenomenon. And so when we look at the very tender issue, I appreciate your framing, we have to bring wisdom to that discussion and recognize the, I would call it sometimes innocent ignorance of the child and the children and the things that we are exposing them to, things that are not propelling them to a more mature and a deeper understanding of life, sex, and its consequences. Some of the work that we have supported, meaning the Kellogg Foundation, focuses on the fatherhood initiative and fatherhood work in our society. That is important. So much of the epidemic of pregnancy by teenage women, I grant you there may have been some research to suggest that some of it was an option that was meeting a psychological need for being connected to another human being. And that is a basic psychological need. It is a basic emotional need. We all need to be connected to other human beings in an intimate way. And sometimes out of expediency and confusion, young people may make that choice in an unwise way. But there's equally powerful research showing that much of the teenage pregnancy that we have in our country, the fathers are adult males. And many of these young girls conceive these babies in relationships in which they really don't have the power of choice and decision. So it really is a complicated conversation. Back to the church role, it's one that the churches need to lead on. And we really do need to have these conversations. We are funding some research that just, and at foundations, proposals come in what we call over the transom. And there's some very exciting research that we've been asked to fund, and we don't usually fund research. But this particular, we call it action-oriented research, is looking at the culture of abuse and trauma that many young girls live in impoverished communities, where their self-image and their self-esteem is being called into question by the verbal assaults that they might experience as they walk to and from school, and the coping mechanisms that these young women may have to develop in order to be all right, in order to be safe. So thank you for that question. It is a big piece of the work that we have to deal with. I don't believe, and I don't like to use shoulds, but I don't think we as a nation should continue to have an escalating single-parent phenomenon. Because our children need 24/7 support and attention, and it's almost impossible to provide the economic base that they need and simultaneously provide the attention and nurturing base that they need if it's just one parent. And so we need to take that on, and I would ask the reverends that are in the room to seriously figure out how you can do that with the precious, precious young people in your congregations.
Today at the City Club, we have been listening to Dr. Gail Christopher, Vice President, Program Strategy at the W.K. Kellogg Foundation. Thank you so much, Dr. Christopher. Thank you, ladies and gentlemen. This program is now adjourned.
For information on upcoming speakers or for podcasts of the City Club, go to cityclub.org.